Hi everyone, in today's Tuesday Talk, I'm going to answer your top 4 burning questions about fat. So let's get started. I have been doing the high fat carnivore now for 6 weeks. Pretty sure that's right, 6 weeks. And I've lost a total of 3 pounds. I had another half a pound weight loss this week. So, you know, slow and steady. The other side of that slow weight loss is that I have increased my calories by 400 to 500 a day from what I was doing prior. So that's kind of interesting. But let's get to your questions about fat. Last week I talked about doing a fat fast, and I showed you my first fat fast. I showed you some pictures and the macros, and I said I was going to do another one, and it was going to be filmed and there'd be a video, and there was. That video is out there in this last week, so I'm going to link that below. So between those 2 videos, it generated quite a few comments and questions, and I am going to try to address those today. Because as you also know from last Tuesday Talk, there's been so many comments. Like, I'm getting sometimes 300, 400, 500 comments per video, and it's hard to answer them all. So thank you for being understanding. So I'm going to try to address these, as well as show you my Dr. Boz chart and, my fat fast meals that I had this week. So the number 1 question that I got was why? Why do a fat fast? My personal reason for doing a fat fast is to enhance my results from doing high fat carnivore. So high fat carnivore is 80% calories from fat and 20% calories from protein. It's typically 0 carbs, but there are carbs in eggs and in dairy products if you use those. So it's pretty close to 0 carbs. So, that can be enough for anybody. Nobody has to do a fat fast. But I was intrigued in hearing from people out there on YouTube and in Facebook groups that they had some, good boosts in their ketones and their GKI ratios from doing a fat fast, and I found that to be true as well. And the results last about 3 days afterwards too. So 1 day of fat fast for me kind of gives lingering results. So why do I want to have that GKI? Now, some people will say, well, you shouldn't chase ketones, you should chase results. And yeah, that's true. What I'm doing with this is trying to chase healing. And the GKI ratio is a good indicator of where, what kind of ketosis you're in. Are you in any ketosis? Are you in weight loss mode, nutritional ketosis, or healing? So I've got a chart up here to talk about the different types of GKI and what they mean. So I've got my chart here so I can follow along. So if you do recall, and I am going to have my Dr. Boz chart up in a few moments, but back when I started this thing, my GKI was 12. Yeah, it was just over 12, and it took me a whole week to get that ratio down. So if we go to the chart here, 9 or above, the reading means not in ketosis. Even though my ketones were measuring 0.4, and I had always been told, oh, any ketosis reading is good. You can't be a little bit, it's like being like a pregnancy test. You are either pregnant or you're not, and the same logic was applied to ketones. You either have ketones or you don't. You're either in ketosis or you're not. I didn't realize there was different quality of ketosis. So according to this chart, now if you can't, I hope you can read the chart. I hope it's big enough. If you Google GKI chart, there's a lot of them out there that you could print one for yourself, cut and paste it or keep it for yourself. There's a lot of them out there, and they all basically say the same thing. So 9 or above, not in ketosis, just living a normal life. I kind of like the way they put that. Between 6 and 9 is a low level of ketosis, and you can lose weight or maintain your weight in that level. And so it took me about a week. It took me a few days to get to that between 6 and 9. So, and that was because I was learning this high-fat carnivore and how it worked and, tweaking. Between 3 and 6 is a moderate level of ketosis, and it is for managing type 2 diabetes, obesity, insulin resistance, metabolic or endocrine disorders. So that's good. So I got into that between 3 and 6, and I was mostly in the 3s until pretty much the end of November. I was mostly in the 3s, which is very decent. My Dr. Boz ratios were in the 50s and 60s. So I wanted to tweak that further because I have heard Dr. Boz say that if you can get under 40, she likes her patients to get under 40 Dr. Boz ratio because they have the best results. And so being that I can be competitive that way, I wanted the best results. So I, kept tweaking. And around the end of, on November 29th, I decided to do a fat fast. And the morning after my fat fast, I had a really good GKI. It was under 3. And my Dr. Boz ratio, though, was still over 50, and that's where the first arrow down towards the middle of well, you probably can't see the Dr. Boz sheet yet, so we'll get there in a moment. So between 1 and 3, this is where I was shooting for high therapeutic level of ketosis. For those using keto therapeutically for the treatment of disease such as cancer, epilepsy, Alzheimer's, Parkinson's, traumatic brain injury, etc. Now, I don't know if that translates to prevention or not. They talk about treating it. But I wanted to be there. I wanted to be there because I don't know what is going on in my body that needs healing, but I kind of felt that there was because of my, extremely slow weight loss. I guess I'm one of those people who believes in hedging your bets. I took care of my mom for the past 5 years with Alzheimer's. That was not fun, and it was hard to watch what she went through as being both obese. She was at least 100 pounds overweight, and having Alzheimer's. That's a bad combination for quality of life, let me tell you. And so if there's anything I can do to prevent that outcome for myself and for other people by letting them know this information, I'm all for it. Now, if you get a GKI of less than 1, that is the highest therapeutic level. Very difficult to achieve without a doctor's supervision. I believe that now I got this from a cancer site. I got this from not a cancer site, but the site of somebody who is using the GKI chart for themselves to put their cancer in remission. I believe they were successful through some of the things I was reading on their site. So, that type of person would want to get that below 1 if they can to stop that. So that's what it's all about. Okay, so now that we know these different levels of GKI and what they mean and why they are important and why they were important to me, we'll go on to my Dr. Boz chart. I have it here and it'll be up there. The only thing is it's getting a little crowded, so I think if I show this Dr. Boz chart again, I'm probably going to omit a whole bunch of this so that it's easier for you to see the numbers. So the first arrow at the top shows where I started on November 1st with a GKI of over 12, and then, you know, gradually improving. So where all these red arrows are, these are significant because on those days I had excellent GKI readings, and they always coincided with the day after either a fat fast or I managed to reach my goal of 200 grams of fat in that day. It is not as easy as it sounds. It has taken me almost 6 weeks for myself, my body, as well as psychologically, to get myself to that 200 gram fat level. I've had to do different tips and tricks to get there. It's not as easy as eating 3 meals and, you know, plunking butter on your plate. I was still not able to reach it. So I've had to, you know, you'll see in my meal, I'll talk about that. I've had to incorporate things like fatty coffee in the morning first before I do much else. You know, evening butter before bed, all those things add up the fat and help me get to that 200 level. So getting to that 200 grams a day, not by weight, but by macros, seems to, the next day when I wake up, my fasting blood glucose and my fasting ketones, the combination is getting me down into below 40 So this past week, I've had below 40 Dr. Boz ratio, and my GKI has been hovering in the ones up to below 3. So these are good things for me. You don't have to do that. As you can see from that chart, between 6 and 9, you're in ketosis. Between 3 and 6, you should be able to manage. If you have type 2 diabetes, you should be able to lose some weight. And you know, but I'm just trying to push it a little bit further. I love experimenting. If you've been following me for a while, you know how much I love to experiment. So, you know, I've been pushing myself to reach that 200 grams of fat every day and to get to these numbers. And we'll see what kind of difference it makes over time with weight loss. I'm okay with the half a pound a week. You know, in 6 months, that'll add up too, right? And of course, the closer I get to where I want to be, the harder it's going to be. I mean, you know, when I look back on my weight loss journey of the past almost 10 years, I think the hardest thing was to get started. There was lots of false starts and stops. The easiest thing was the first almost 100 pounds. That was easy. But then once I got to that, it became hard again. It was just hard. It just, like, the first 100 pounds didn't take that long. The last 30 pounds, once I reached 100, has been a few years, because I've had, again, some just, you know, long plateaus, and then finally had to be tweaking. You know, I'm always tweaking to get to the next level. You know, that's why I'm doing this high-fat carnivore, because things, you know, regular carnivore worked until it didn't. Keto worked until it didn't. Low carb worked until it didn't. I mean, don't be afraid to tweak. You know, sometimes you have to. I mean, I think anyone who has a large amount of weight to lose, what you eat on the day you start is going to look a lot different than what you're eating the closer you get to goal. I'm pretty sure that's going to be the case for most people. I never like to say absolutes. It's not 100% true. There's no universal truths in this. So hopefully that kind of gives you some information about, what to look for when you're tracking the Dr. Boz ratios and GKIs. I want to finish these questions. So we answered the first one, why fat fast? Because I want those lower GKIs. The second one was surprising to me. A lot of people seem to be upset that I called it a fast because there's no food. Well, having no food is one kind of fast. There are other types of fasting out there, and I believe this might be called I've heard it, I couldn't find where I had read about it, but I had heard that this could be called a macronutrient fast, where you focus on one macronutrient. So is it a fast? Is it a fast when there is no food? Well, when I look back on, things that I know about, and I'm sure some of you know about others, there are other types of fasts out there besides a no food fast. For example, this may surprise some of you, but I spent 10 months as a raw vegan before I quit. And they were all about juice fasts. So you would have a juice fast for a week. Nothing but juices that you pulverize. That's why I have them Vitamix, was from my raw vegan days, so I could make these juices. So that's a fast. There's the egg fast. A lot of keto people do the egg fast, which, by the way, is the macros for the egg fast. If you're doing it properly, it's like for every egg you eat, you also eat a tablespoon of butter. They just happen to be 85, 10, 5. So 85% fat, 10% protein, 5% carbs, because eggs, of course, have carbs. I think that's just a piece of trivia aside. I mean, I think that's why people do so well on the egg fast, is because it is high-fat carnivore when you think about it. There's the sardine fast everybody's talking about, where you eat nothing but sardines for 3 days. That's a Dr. Boz thing, and she says that boosts your ketones just as much as not eating. Now there's this fat fast. So don't be upset by the fact that it's called a fast, because it's a different type of fast. It's not a no food fast. It's where you focus on one food only, or one type of food only. What are the benefits of doing a fat fast besides those GKIs? Well, for me, a big benefit is that you get to eat. I cannot do a fast where, for 3 days where you don't eat. I can't even do one of these other fasts for 3 days. I usually only last a day or so on the fat fast. Sometimes I've extended it to the next morning. That's about it. I am going to try the sardine fast. I do have a case of sardines coming my way. I don't know if I'm going to last 3 days. I'm going to give it a day. I know I can last a day doing anything. Whether or not I can last 3 days, it's another story. We'll see. So, I don't think there's anything wrong with calling this a fast. And, if you don't agree with it, that's okay. Just humor us, people who follow these other types of fasts. I had several questions and comments about how to avoid GI issues, gastrointestinal issues when attempting a high-fat carnivore. So a few suggestions that I have, and this is from watching people like Kelly Hogan's videos, Steak and Butter Gal, those types of people who talk a lot about high fat and fat fasting, and Dr. Bright interviews, that sort of thing. It seems that eating solid fat as opposed to drinking your fat, like pouring your rendered fat over your meat, having bulletproof coffees, that sort of thing. Some people do better with solid fat, so like an actual pat of butter instead of the melted butter in your drink. Myself personally, if I have a coffee, and I know this from, personal experience, if I have a coffee with more than 2 tablespoons of fat in it, I am glued to the bathroom for hours afterwards. I cannot do. Someone actually did ask me, why go through all the trouble of doing a fat fast? Why not just drink these coffees all day, or hot water, or whatever type of thing with, melted butter in it, or coconut oil, or whatever? Some of us can't. Some of us cannot have that much liquid fat. And so I completely understand that. In fact, I've heard of some people who even cannot have, that, like, they have to eat their fat raw. So, and I'm not talking about butter here, I'm talking about things like suet, beef fat trimmings, even air frying them or baking them or something. Some of that fat is becoming liquidy and getting rendered. They can't even do that. They have to cut it up into little pieces and just pop it in their mouth cold. So, everyone is different in how they can tolerate fat and which fats. I mean, some can do lard from pork and some cannot. Some cannot do butter at all. That actually brings me to the 4th question, which is, why can't I just have butter all day? Why can't I just fast on 2 sticks of butter, say, for example? You can, if you can tolerate that. I worry about that a little bit. I worry about becoming dependent on one type of fat source and then becoming sensitive to it. I like butter so much that it would be kind of a tragedy if I got to the point where I couldn't eat it anymore because I developed a sensitivity. So that's kind of my motivation for diversifying the fat. Another part to this question is, it is actually a separate question, but I did get it a lot. So there's actually 5 questions but before I leave the other question of GI issues, start slow. If you have GI issues, don't feel you have to do 200 grams of fat on your first day. It took me almost 6 weeks to build up to 200 grams of fat. I have my gallbladder. I mean, I can only imagine, like, for any of you that have some other issues like that, start slow. You don't have to get there on day 1. Just build it up. Okay, so the last thing I want to address is a lot of people have made comments that they added a stick of butter, some even 2 sticks of butter, and they're gaining weight. So very few people can just do that. There are some. I have seen people on YouTube who add 1 or 2 sticks of butter to their daily food, no matter what that daily food already is, and they are doing fine, and they can do that. Typically, I have yet to see someone who's like me be successful with that strategy. The people that I have seen are young, fit, healthy people that do not have the type of history that someone like me has. I have yet to see someone who is in their 60s like I am, lifelong history of overweight, potentially insulin resistant. I've never been diagnosed with type 2 diabetes, but that could just be some kind of dumb luck, because there's a lot of people like me who have type 2 diabetes. If you are that type of person and you've been following the regular carnivore advice of eating 2 pounds of meat a day, and then you plunk 2 sticks of butter on your plate, there's a good chance. I'm not saying 100% chance. I'm just saying a good chance you will gain weight with that strategy. And it was something I worried about as well. The key to the high-fat carnivore is for someone like me, not for the young, healthy, fit people who can, do that adding 1 or 2 sticks of butter. For someone like me, the key is lowering that protein. Lowering it to 30 grams, not by weight, but by macros, which is 3 to 4 ounces of protein maximum at a meal. Now, I tracked carefully to get to that point of where I knew exactly what to eat, and now my GKI numbers are proving my point to myself. You don't have, like, if you are totally against tracking, because so many people have said, I came to Carnivore so I wouldn't have to do all that BS about tracking. I get it. I'm busy too. But for me, I guess because I was a science major early in my university career, I need to know all variables. And so, that's why I test, I look it up. I don't mind doing that extra work. But here it is. Eat 3 to 4 ounces of protein per meal. If you don't want to weigh it, it's the palm of your hand. We all learned that in school. With the palm of your hand, eat that much protein and add at least 2 tablespoons of some kind of fat to that. And if you do that, you will not exceed, you shouldn't exceed 30 grams of protein in a sitting, and you should be very close to the 80-20 high-fat carnivore. So that would be an easy way for someone who is a non-tracker to do this. So because I've talked so long, I want to get to my fat fast meal or day. Again, I'll link that video below, but you should see up there what I ate that day, just for those of you who missed the video and want to know what does a fat fast look like. So top left-hand corner is my butter coffee, has 2 tablespoons of butter in it. Whipped it up with my little Aero latte. It's one of those little frothers. And that was my first meal. My second meal was suet. And in the video, I show you how to buy it, what it looked like in the store, so you don't confuse it with beef fat trimmings, because they're 2 different things. So the suet was chopped into pieces and air fried. Then I had beef fat trimmings, chopped into pieces, air fried. And I also made tallow butter bites, and they are half tallow, half butter, because I'm trying to, I would have preferred all butter because I love butter, but I'm trying to learn different ways to eat tallow. So I'm, it's kind of a transition butter bite. I will probably lessen the butter until I can just eat the tallow like that. So we'll see if that ever happens. But on this day, I had 97% fat and 3% protein. Normal high-fat carnivore day is 80-20. This is a fat fast day, so 97.3. So I think I'm worried about how long I have been speaking, and so I'm going to end it here. Look for all the links below to some of this information, and please ask any questions that you want. And so what I'm doing now is I'm going through the comments and writing down questions, and I will address them. So thanks for watching, and I am filming another Fat Fast tomorrow with different foods, and you will see that next week sometime. So we will see you in the next video.